Hello everyone, welcome to Life in Ortho. So today we'll be discussing a brief introduction about MRCS. Now what is MRCS? MRCS is member of Royal College of Surgeons. This is basically UK. So this is the pathway to go to UK for surgeons. Okay, there are many pathways to go into the UK. One is PLAB, one is then PLAB means you have to go through the general physician pathway or the GP pathway, where you will be posted as a general practitioner, you can say, at various sites, and you can refer. If you want to retain your surgery branch or ortho or whatever, you need to give something known as MRCS. So MRCS is a multidisciplinary exam where there is approach from all the basic sciences and general surgery. Then there are MRCS is divided into part A and part B. So part A is your general medical knowledge, that is basic sciences plus applied surgery. That is what part A is about. Part B will refer to your OSCE. What is OSCE? Objective Structured Clinical Examination. So that will be your branch specific. So we'll talk about MRCS part A today. So you have to, for giving the exam, you have to apply through the intercollegiate MRCS site, where you can search for how to apply MRCS. So you basically need to send your application online along with postal documents within 7 days of the online application. Okay, so this is one of the eligibility criteria. Second eligibility criteria, you need to have a temporary or permanent registration. Let me know whether you have it or not in the comments. That is for a medical practitioner, that is must. Anything else is there, then it costs you around £625. This is the educational, or you can say the fees for MRCS part A. Okay, so this is your brief about it. Now we'll discuss in detail. So it is a 5-hour MCQ based exam taken by a company called Pearson View. This is the company you need to look for in your search history, or you can search for this company and they will let you know what is the basic MRCS. So this 5-hour MCQ is over a 1-day period. Okay, in a single day your exam will be over. It is into 2 parts. So there are 2 papers. One is your applied basic sciences, then is your principles of surgery. Okay, so your applied basic sciences is a 3-hour exam with 180 SBAs. What is SBA? Single best answer. Okay, and they are basically practical based or practical oriented theoretical knowledge assessment. Okay, so there are 180 SBAs in principles of surgery. There are, so it is of 2 hours in length. Okay, there are 120 questions, but subject to be noted is that it needs to have, it has themed EMQs. What is EMQs? Extended matching questions, which are a little bit tougher as compared to your SBAs. Okay, so there are, I can explain it to you. So there are basically themed means there will be a theme involving 2 to 5 questions. They'll tell you a clinical vignette, and there is a selection of potential answers. So that is what your this thing is. Obviously, only 1 mark per question is awarded. Okay, and major thing to note is there is no negative marking. Obviously, you cannot leave the examination hall 60 minutes prior or in the last 15 minutes. In between, you can get it. You can get some hydration or everything that you can do. And so I would guide you that examination is nothing but mental strength. So if you put your mental strength at it, and if you are confident that you will pass, most likely you will pass. So how do you pass? You pass through something known as a percentile score. What is a percentile score? Percentile score means the highest achieving person is the 100th percentile. Below that, whoever comes below it, so they will be marked according to that person. So usually the passing rate is 60 to 67th percentile, or you can say amongst the more than 50% you have to get right in order to pass the exam. And then you need to study. We'll talk about studying of MRCS in further videos, and I would wish you all the best, and let's hope we all get it.